Hi everyone, welcome to our spinal cord anatomy course. Now, first of all, let's introduce myself. My name is Abbas Ahmed and I am a medical student at the third stage in College of Medicine. By the way, I am from Iraq and this is my first course on udemy.com, and I hope that I could meet your needs. To contact with me, this is my email, and I hope that we will be in touch together. Now, what we will study in this course, as you know, our course spinal cord anatomy. In this course we will study the gross and the microanatomy of the spinal cord, and we will apply our knowledge in neuroanatomy with the most important clinical corrects. So we have a theoretical part and we have a clinical part in our course. So why we will choose this course, why we will study this course? First of all, it is to know the structure and the function of the spinal cord from a medical point of view, and then to correlate between the functional anatomy and the presenting diseases and injuries regarding the spinal cord. For example, if someone came to you stabbed with a knife in his back, and he will, of course, he will have a certain criteria that make him very easy to identify the injury, to identify the site of the injury, and so we can make a differential diagnosis, and we know exactly what location has been damaged and how this could affect this patient. Now, they say that in neuromedicine there is a very little differential diagnosis. What is the meaning of this statement? Let's see. In neuromedicine, or in the central nervous system and even in the peripheral nervous system, every lesion have a specific criteria, and it will produce a certain signs and symptom in the patient that could be differentiated from another lesion. So lesions of the central nervous system usually are specific to a certain criteria, and if we know these criteria, we can know the lesion, or we can and this will of course help us in treatment of the patient. So the our hope in this course is to know the criteria of certain injuries regarding the spinal cord, and we cannot predict the criteria without studying anatomy, without studying neuroanatomy of the spinal cord. Now our lectures are of 9 lectures regarding spinal cord anatomy, and you will find them on the curriculum page on the website. Our lectures have many different subjects. You can see here we'll start with studying the spinal cord limits, segments, enlargements, and the spinal cord covering or meninges. Then we will study spinal nerves roots, and we will study the blood supply to the spinal cord. This is very important in certain lesions of the spinal cord. Then we will study features of the gross section of the spinal cord. We will study the tracts of the spinal cord. Tracts of the spinal cord is a very important subject to study. Also, we will study these tracts. In each video we will handle one tracts, like the anterolateral tract, the dorsal column, medial meniscus system, the spinocerebellar tract, corticospinal tract, and lastly, video number 9 is the most important video. Actually, it's the information in this video depends on informations in the previous videos. It will handle the clinical anatomy of the spinal cord. We'll talk about the special injuries, their criteria, and how to differentiate them from another lesions, and how to manage them. Now, our resources for the picture part, we have Netter's Atlas of Human Anatomy, and for the theoretical part we have the Snell Clinical Neuroanatomy. So links to download these resources, I will put them on the website, and it will be easy to you to download these resources. Now, thank you all, and I hope this course will benefit you on different stages, and it will make your knowledge more developed, and you can handle the lesions and the injuries regarding the spinal cord in a way that you could manage them correctly.